Professor of Medicine, Philippe Morel, Switzerland. Surgeon FMH General in Visceral Surgery, Honorary Professor of the Faculty of Medicine of Geneva, Independent, Member of Parliamentary Committees, Member of Diplomatic Club of Geneva, Member of the Committee États Généraux de la Santé, Geneva, Chief of Department, Visceral Surgery, Director of the Department of Surgery, University Hospitals of Geneva, dates employed 24 years, 1994 through October 2018. In 2006, Professor Morel started the Visceral Robotic Da Vinci program at the University Hospital, Geneva, where over the years he has performed about 2,000 robotic surgical procedures, including bariatric surgery. Professor Morel has organized several postgraduate training courses in robotics, as well as in less surgery, and inaugurated a training facility within the University Hospital, Geneva. Until 2018, he was Switzerland delegate at the European Council in the context of organ transplantation CDPTO group. Until 2018, Professor Morel was vice chairman of Swiss Transplant. He is now active at the Clinique Générale Bellu in Geneva, at the Clinique Valère in Sion, as well as the Clinique Genolier in Genolier, Switzerland. Professor Morel is the author or co-author of over 450 papers. He also writes books which aim at popularizing organ transplantation and increasing awareness in this field among patients.
My name is Philippe Morel. As you can see with my shirt, I'm a doctor. I'm basically a surgeon. I was chief of visceral surgery and abdominal surgery at the University Hospital Geneva, and I was chair of the Department of Surgery for 25 years. And actually, I'm working in private practice. I had three major interests in my career. First was solid organ transplantation, and I have been trained in the US for roughly 3 years for this. Second is robotic surgery, that I was one of the initiators in my country. And third is abdominal visceral surgery, and I have been trained in England for this. Now, I think that the aim of your conference and the aim of your get-together is highly important, because I always thought that doctors had a role to play in bringing people together. Because basically, you know, when we meet in meetings, there is no difference in age, sex, race, origin, political conviction, nothing. We are united by the fact that we work for the patients. We try to treat through the best of our knowledge the patients. And this communion, it's really a communion between doctors worldwide, look to me to be an example of how people should and hopefully one day would go together in the world. But there are so many differences between populations, between continents, between countries, in other areas than medicine, that of course there are some barriers to be faced and to be treated. I have been involved in politics at the level of Geneva, so I'm a deputy in Geneva since many years. But one of the goals of my involvement in this is trying to help the people who need, not only in Geneva and Switzerland, but elsewhere. Besides this, I have been working and traveling in several countries to help, to contribute. I have been in Libya for several years. I went on a regular basis and I had a wonderful experience in Libya. I went also to Bangladesh, I went to Egypt, I went to several countries to contribute with my colleagues locally and to help them treating the patients and giving the best of care that we could give under those circumstances. I think that, you know, there are some major differences. The first one is some people, as you well know, as everybody knows in the world, don't have enough to eat or enough to drink. So feeding the people, allowing them to have enough food and enough water that they can consume is already a major problem that has to be faced. The second one is getting a work, meaning getting some income, getting some money to be able to buy clothes, to bring children to schools where there are schools. So this is a second major problem. And I think if we face those two problems, that everybody has enough to eat and to drink, and that people have some earning to live a decent life, then we will already have made a major step forward. However, there are other differences and other problems that people are faced with. I think, by the way, that, you know, religious convictions, political convictions, ethical convictions can be overcome. And they can be overcome when people speak together, when people come together, when people understand each other and agree to understand each other. And it has always been surprising for me to meet people from very far countries where we had nothing in common initially. We had differences in race, in convictions, in politics, in religion. But when we started to talk together, when we started to, you know, figure out the world together, very quickly we came to a community of ideas, I would say, and a common view on how people on Earth should be together. We know it's a dream, but to achieve reality, you have to start by a dream. Yeah, I didn't want to extend, but you are fully right. I mean, education is a major step towards a better understanding of each other, and medical care is a basic principle. Everybody wants to have care to prevent pain, to treat diseases, to feel better, to live longer, and to be less suffering. So, of course, education and medical care are very, very important in the field. I didn't mention them because I wanted to be rather short. And I think that those two areas can be achieved with an investment in every sense, of people and population and countries who are lucky enough to have those values. I mean, education and healthcare, I would say, not medical care, but healthcare. Well, peace is a major issue and a major problem. But I think that, you know, tension between people initially are raised because people have differences, because one wants to have what the other has, or because one wants to convince the other that it should change. So those tensions should be approached and should be, I wouldn't say solved, but worked on so that tension will decrease. And tension, of course, is leading to aggressivity and leading to wars. And if you look at the actual situation on Earth, I mean, there are so many areas of major tension, and there are so many areas of war that just mentioning the name of peace is a challenge. Is a challenge because, unfortunately, in many areas in the world, we are far from peace, whether we have major tension or we have clearly wars going on. So yes, every attempt that is made, every initiative that is taken, every step that can be taken to go towards the aim of getting peace and trying to make a better world is worth it, has to be supported and has to be followed. Well, everybody is confronted with climate change. However, I would tell you that today we are in July in Geneva, and we have a wonderful winter this summer because the temperature is very low and it's raining and it's pouring since days and days, and there are floods. But it's a fact. You know, I'm not an expert in climate. I read what I find. I read with interest the proposal. I think there is clearly a major issue in the climate, and everybody knows it, and nobody can deny it. The problem is how much of these changes are related to human activity, and how much of those changes are related to a course going on in the evolution on Earth. And we know from studies that there have been in the past, a long time in the past, different climate changes, major climate changes on Earth. So how much is due to human, how much is due to natural or spontaneous evolution, I cannot really figure out. However, if we can act on the human part of it, I think we will make a major step forward. Now, climate is one thing. I'm also concerned by another problem, which is pollution. Pollution of the air, pollution of the sea, pollution of everywhere. And this is really clearly linked to human activity or human mishandling of the nature and our environment. And I think that this is also a major issue that should be addressed. How can we make that people contribute less or do not pollute the sea, the air, and the earth? This is also, to my view, a major issue. But I think many governments now are clearly aware of this situation in the way that they take political decisions and political steps to prevent further deterioration of climate, at least in the part that is linked to human activity. The other part, which is nature and spontaneous evolution, of course, is something completely different. But I would like to see the same enthusiasm also in decreasing, again, pollution of the waters worldwide, the air and the soil. And I think this is also very, very important. When you think that some fishes have absorbed how many kilograms of plastic, how many kilograms of bottles or whatever that has been thrown into the water by human beings. So both issues are, in my view, among others, of course, but are very important to be addressed. The problem with climate will, of course, interfere with health in several areas in the world. If you think of heat and loss of water or lack of water, this will interfere with the health of the people. In terms of lacking water will mean lack of food, lack of people being not nourished. So this is a major issue. On the other hand, if you are living in a very wet area where the climate is really raining and pouring, this will also, of course, affect your health in terms of lung affection or cardiovascular affection. So there is clear, we are part of nature. We are one piece in the nature, and nature will affect all animals and of course, all human beings. And there are diseases clearly linked to the change of climate by itself or to the change of environment of the human being where they live. So yes, climate and pollution are clearly interfering with health. And this is also one reason why we should act on both of those problems. I think, that the climate refugees are linked not to the climate itself, but to the consequences that it has on their day-to-day life. If you live in a country where you have dryness, where water is lacking, you have a lack of food, a lack of everything. So, of course, you will migrate to another area and try to migrate to another area. If you are in an area where it's very cold, freezing, and also you have the problem of feeding yourself, then you will migrate on another area. So the climate itself is maybe not the major issue, but of course, it's the major cause of the changes around human beings that will force them sometimes to migrate and change their environment so they can live in a better life, get food and get water. But I think that one issue in migration, in major migration, the one we see and face yet in Europe, is really the difference between the overall quality of life, let's call it like this, quality of life, that those people have in their own countries and what we have here. And of course, when they compare, and we would all do the same, when they compare how they live in their countries, with all the respect to those countries, with all the respect to those issues. But when they see the difference, they want to be part of this development that we have, at least the good part of it, because there are also downside. And I think migration is also induced by those huge differences we said before in education access, in health access, in having food available, and all these things that makes your life good and better. And the people who come, and I have met some of them, are people who are really attracted by this quality of life, not taking into account the fact that, of course, the countries they come from, most likely, or most of them, try to do the best to support their citizens. Not always, not always. So climate induces changes, induces migration, but also the major differences that we named do induce migration and major migration. And I think this process is going not only to continue, but to increase and to grow up. And we are going to be faced with a growing number of people trying to come in the Western Europe, Central Europe, and also, of course, in North America. And we have to face this issue and to try to find solution. And one of the solutions, of course, is to help those people in their own countries to get what they are looking for and support those countries so that those people can stay in the country. Because, of course, living in a country is living sometimes part of your life, living part of your family, and living part of your day-to-day life, maybe religious belief and other things that you are basically linked with in your country that you will lose when you go in another country, especially when it's far away. We should get along together. That's why we should talk together. That's why we should try and be able to understand each other, to understand the problem, the issues that people are facing. Because in some situations, we think that some people need this and this. In fact, it's absolutely not what they want. So talking together, explaining the situation, exchanging is the first step to try to find solution to major issues worldwide. And again, the initiative that you have has to be strongly supported because it brings people in talking together. Somebody will listen to what I say and will say, no, this is wrong. This part what you said is wrong. This is not how it is. And I'm convinced I'm right, but I might be wrong. And this person can explain me that, no, what I see this way should be seen another way. And then will induce that I will change my mind about the topic. So I think that by talking again, you start to understand each other. And even if you have large differences in every sense, talking is the first step to try to bring people together. Well, after having mentioned what we said in the previous minutes, it looks to be a little bit futile to talk about robots and robotic surgery because this is a technology that is addressed to a very minimal number of people on Earth, unfortunately. That is very expensive. And I would say this figures out the difference between some countries, let's call them, although the word is not appropriate, developed countries that can afford this type of medicine. And what I have been seeing in other countries where, patients and doctors and surgeons in my field are struggling to find the basic necessary instruments and devices to treat their patients. So it's a huge difference. Some people say, robotic surgery will allow a surgeon in Germany to do the surgery for a patient in Central Africa. No, wrong. This is not, even if it was technically possible, this is not what those people need. They don't need robotic surgery. I can tell you, I have been asked twice, but once I remember very well, by a government, health government of a country, I won't name the country, if I could give my opinion and make a report on how the robots would be necessary in the country and the hospitals. And they brought me in the country, they brought me in the hospital. I can tell you I never wrote this report because I saw those people had very important other issues to address in healthcare than buying, let's call it fancy robot. And they would need basic care and not buying a robot. So I never wrote this report. And it's a country that is not very far from Europe in the south. But still, robotic surgery is here and will develop. To figure out and to explain you what I think, I will make a comparison. About 40 years ago, man went on the moon several times. Imagine how much technology, communication, materials, technology as a whole is needed to bring men on the moon and to bring them back on the Earth. At the same time, about 40 years ago, everybody in this operating room, the one who had the chains, are still working with what I call a knife and a fork. We were using instruments that existed since not hundreds, but thousands of years. The Egyptians had instruments similar to ours. And the development of surgery over those hundreds of years and thousands of years has been achieved only because of two reasons. The first one is the control of pain, painkiller, anesthesia, the ability to operate patients without pain. And the second one is the understanding of infection, the prevention of infection, the treatment of infection, asepsis, and of course, antibiotics. Those are the two major steps forward that allowed the patient to benefit of surgical procedures. And then there have been several surgeons describing how you remove a stomach, how you fix a bone, how you retrieve a foreign body from the throat and stuff like that. Now it's the first time with a robot that really the surgical instruments are changing. Not only the robot, but also everything that we call minimal invasive surgery. Minimal invasive surgery, as you know, is what we call the keyhole surgery. It's doing surgery through little holes, an instrument that we introduce through those holes of 5 to 10 millimeters through the thoracic cavity, the abdominal cavity. So this change of large opening, touching with your hands, looking with your eyes, has been changed to keyhole incisions, moving with instruments that are very different from the previous one, and looking the operative field on a screen, exactly like you look on a TV screen. So on one hand, it has been a benefit for the patient, small incision, less risk of pain, less risk of infection, less risk of hernia. On the other hand, it has been a difficult task for the surgeon because they had to deal with a 2D picture, 2D vision, and a mobilization of instrument that was strongly limited. Yet came the robot. The robot's first contribution was to allow the surgeon still to perform keyhole surgery, but using instruments, the robotic instruments that have a mobility in extension, flexion, and rotation that is not similar to the hand, but even better to your hand. And second, it gave back to the surgeon the 3D vision, which is so important. So the first contribution of the robot is allow the surgeon to see better and move better, and therefore, most likely to perform a better surgery to his patient. Yet, this is the first step. Now, the robot will allow to develop what we call navigation, surgical navigation. How shall I explain this very simple and very quickly? I will tell you the following thing and make the following comparison. The pilots flying plane do prepare their flight beforehand. They look at the weather, they look at the way they should go, the orientation, and they prepare their flight before going in their plane. I had a friend pilot a few years ago who told me I can sit in my plane in Zurich, gate 28. I want to go to Heathrow, gate 13. I plug in what I've been recording. I don't touch anything, and it will fly me to the exact area. Well, this should be done also in surgery. How? We have imaging that is very performant, CT scan, RMI. We have devices to transform those pictures, 3D, 4D, 5D pictures. We can work on those pictures, the one of the patient. We can plan surgery using, for example, the liver of a patient, plan where we will cut the liver. We could then record what I would call our best shot, the one where we think, okay, that's the best plane, the best area where I should go to remove this liver tumor. Recording this before surgery could allow you, like the pilot, to deliver it on the CD or whatever support during surgery, having the robot doing what you planned to be done. So this is called navigation. And this will allow not only to have a better surgery given to the patient, but it will also prevent the patient from having in the operating room the most dangerous thing. And the most dangerous thing for the patient in the operating room is the surgeon himself. He can be in a bad mood. He can have abdominal pain. He can be tired. He can interact with people around him that he doesn't like. All this will affect his performance. If you do it before, you are quiet in your room, you can even show what you plan to do to colleagues, seek their advice, record your operation, and deliver it. So navigation is a very important thing. Now, intelligence, artificial intelligence, of course, is the next step, because you can imagine that it's not you that is planning the surgery, but it's some sort of artificial intelligence that will tell you where you should cut this liver, to take the same example, and remove the tumor, where you should go. And the surgeon will have not only less work, but probably more work to do this, because he will have to record all the figures, to evaluate all the possibilities, then give it to the support that will analyze it, the artificial intelligence device that will analyze it and give the best solution according to the situation of this single patient. So I think that in medicine and surgery, I used to say, are little babies. They are not even grown up. We have so many things to learn, so many things to develop. About 40 years ago, men went on the moon. And we want in surgery, but also in radiology, also in internal medicine, to go on the moon. And the way is still very long. But the technical possibilities, the technical devices are there. And they have to be managed, they have to be changed, they have to be adapted for the need of the patient and the need of medicine. But they are here. You know, in my lifetime, I have been seeing so much development. I started to be trained in open surgery. I went then to minimal surgery. I was chief of division in Geneva at this time. And then I introduced in 2006, so in fact, very recently, the robot, when it came on the market, the robot. Further development will come and will be beneficial for the patient. And I used to say that, you know, I look forward to be a patient in a couple of years, because there will be wonderful devices. Oncology, how much development needs to be done, but has already been done in oncology, to detect the tumor, to assess the evolution of the tumor, to better treat the tumors, to evaluate what type of oncological treatment should be given to one single patient. So medicine is a baby, surgery is a baby. We need a development. Robot is the first step of this real development. The next step would be, in fact, to replace the surgeon himself. And I show this wonderful picture that you can see on YouTube of the robots playing football with President Obama. This is a robot developed in Japan that could, you know, hit the ball towards President Obama like a footballer would do. Soccer, you say soccer. Or this robot can move himself around, can speak, and one day will be able to think and have affection. I looked at a TV show a few days ago where they showed what is in preparation, especially in Japan, where they say, well, two things are missing, two key things are missing. First, of course, is intelligence, the ability to assess a situation. And second is all the affective aspect of human being, you know, how a human being is affected by his environment, whatever, emotions. Those are the two things missing. At the end, I said, well, I'm glad this is still missing, because otherwise human beings are going to be replaced by robots. So I think one day we'll be able not to replace completely human being for doing those tasks, but support him a lot. And there are actually several areas in the world where robots are under development with this idea, navigation and really a robot. Because actually the robot is a wrong name. Robot means it has an autonomy. The actual robot is what we should call an articulated arms or articulated arms, because there are 3 or 4 of them. But it's not a robot in the sense it doesn't have any autonomy, any spontaneous movement. Every single move is directed by the surgeon. And we would like to change this so that some moves are either automatic, like sewing. We know that the robot can do a sewing by himself, very precise, very accurate, very good, probably better than human being, or do other tasks that are pre-recorded and delivered in real time. The concept is to have a long-distance assessment of a patient and a long-distance diagnosis for a patient. And I take one example. A few days ago, I was participating in the vaccination of patients in a center in Geneva on a voluntary basis, of course. And you have to assess the temperature. A few years ago, you had the physical contact between the instrument and yourself. Then under the arm or elsewhere. Then you had this ear thing. And now you have an instrument, as you know, that is 10, 15 centimeters from the head of the patient and will assess the temperature. And I think if we could assess other values like proteins, like level of red cells and so on, that could be done at distance, it would clearly help a lot. And the next step would be that a machine, let's call it a machine to not call it a robot, would go to the patient, make this assessment and deliver the result in almost real time. So you can provide care to many people away from the place where you are. And we could use this for countries where they have not enough doctors, they have not enough means. We have not enough doctors or nurses to bring there, but we could bring those devices to help and support the local doctors in their assessments and their treatments. So it's not really artificial intelligence, but it's integrated intelligence and integrated analysis that would bring support. And we are not far away from this. We are not far away from this. This could be done, and this could help as one other step for the population that do need it, which means roughly 2/3 of the world. Prevention in medicine, prevention in diseases. As I told you, I spent most of my career doing solid organ transplantation or even cell transplantation for the pancreas and diabetic patient under the form of transplantation of islets of lung runs. But I always said, transplantation is to cure a disease, but the final goal would be to prevent this disease. I'm thinking about hepatitis C, giving liver cirrhosis, and most of the patients on the waiting list for liver transplant now are suffering not from alcoholic disease, but from hepatitis C cirrhosis. So those patients should not reach this point, and prevention should be the best way to prevent the need of solid organ transplantation. We are always in a lack of organs. There are always many more patients on the waiting list than there are donors. So of course, those on the waiting list, part of them, unfortunately, and very sadly, die because they didn't get in the right time the organ that would have saved their life. But the final goal is to prevent those diseases to occur. Some diseases of the kidney that can be prevented, some diseases, as I said, from the liver and from the lungs. And we're not talking about people smoking, we're talking about other diseases. So prevention is a major investment. The problem is in politics, nobody wants to invest in prevention because, you have to wait years and thousands of patients to see the results. So it's not very sexy to propose a large campaign in prevention. However, as an example, there is one yet in Geneva to detect early detection of colonic cancer. So preventing a disease or preventing this disease to evolve is a major issue and will by itself decrease the cost of medicine, allow more people to be involved in this prevention, and ultimately increase life expectancy of the people. If you could prevent hepatitis C, and we can prevent hepatitis C by vaccination, then you would decrease the number of cirrhotic patients, decrease the need for solid organ transplantation, decrease the number of deaths, improve quality of life. This is one example among others. We could also talk about the vaccination for the COVID. This is a major today's issue. And this is prevention medicine. Vaccination is prevention medicine and will help to improve healthcare on a global scale. 3D printing, for example, again, the example of transplantation, there are some examples of 3D printing of kidney, 3D printing of livers, and this is a very promising development in this field, but also in many other fields. 3D reconstruction of bones, of many situations, 3D printing as a whole, not only as a static, I was talking about bone, but living cells producing an activity, making the work that they have to do. So 3D printing, the development of 3D printing, which is pretty quick, is a major change for patients. We still have the problem of miniaturization. We still have the problem of length of functioning and dedifferentiation of the cells that are in those models. We still have problems, of course, to face, but 3D printing is and will be a major step in many, many areas of medicine and surgery. When I finish my talk on robotic surgery, I go to mini robots and nano robots. Yes, they do exist. Yes, it's fascinating. Yes, one day we'll be able, not only through the vessels with nano robots, but also in terms, removing, let's say, take a very simple example, removing an appendix in a patient having appendicitis. You make one very small hole, or you go through the vessel, but let's figure out through a small hole. You introduce 3, 4, 5 mini robots in a magnetic field, and you make them do the work that was done by open surgery a few years ago. So nano robotics will have not only the goal of doing things, but as you clearly refer to record situation, recording the activity of the muscle of the heart, recording biological values locally. And this will be useful to treat tumors, because you can imagine that those nanorobots will bring with themselves, for example, some radioactive substances that will be placed directly in the tumor and will help contribute or even completely destroy the tumor. So all this miniaturization will contribute to help taking care of the patient. This is, when you talk about nanotechnology, you're already between the Earth and the moon, always referring to the travel from the Earth to the moon. You are really pretty high in the distance to the Earth when you figure out this. But still, there's a long way to go to reach the moon. Well, you don't see those people in the airport, as you say, but I don't want them to line up as unemployed people. And the balance between, suppressing human being for less expensive, because this is almost the only goal, less expensive means to do human work is, of course, a trend that is taken. But as you clearly refer to, we don't want to make more unemployed people. So, well, there are several answers to this. First, I think that our economical system, the one we have actually, forces enterprises to decrease the load of the salaries and the load of the expenses in salaries. So automatization, when you go in the supermarket, you go to the cashier, basically they are not useful anymore. There are even places you know very well where you can go through by scanning your thing, paying with your card and getting out. You don't need anybody. But what are those people going to do? And this is the major issue. So yes, it's a trend. It's a trend that will continue, but we have to be very careful so that we don't jeopardize the future of so many people. One answer would be those people that are not at the cashier, for example, to take again the example of the supermarket, can be employed to build the devices that will be recording the thing you bought. So you can transfer some of the people to other jobs. But we know that this is not 1-to-1. This is 1 to 0.5. So we have more people doing the work than we have people building the devices that will replace them. So this is an issue. The other one, of course, is birth control. And birth control is a complete different issue, but it comes in the frame of we will need less people to do the same job. We will even need less people to do more jobs. We are talking of suppressing pilots in the plane. We are talking of suppressing the stewards in the plane. We are talking of suppressing the drivers in the buses. What are those people going to do? I mean, what is the future we offer them? What is basically the future of our society in these non-human services? Those are non-human services. I'm not a fan of it. I'm not a fan of it. When I go to the supermarket, I go to the cashier, I like to have somebody that I can talk with, that I can exchange a few words, you know, a smile, something human. When I go to scan and pay, I feel frustrated when I went out, because I went in, didn't interact with anybody, took my stuff, and then went out without meeting anybody. Still, there are a lot of people around me, but I don't interact. So there is also the human factor. Economical factor is one thing. Technical aspect is the second one. But the human one should be the priority and should be the most important one. And I'm concerned and worried to see that in many areas, many places, human activity is replaced by machines and devices that are not human. You know, before you would go to the bank to get some cash. No, you know, you go to the cash box. So I introduce my card, I tape how much I want, my card, and I get the money, and that's it. So many banks have been closed because of this. And it comes in every area. But what I mean by this, in our day-to-day life, it does concern each of us, and it will affect each of us. It's a dream, but the dream is the first step again to maybe, hopefully, one day reach reality. So we should try to make this dream come true. And the dream is talk to each other, be willing to understand the others, be willing to interact with the others, be willing to question yourself, to raise questions about your beliefs, your thoughts, and your conviction. Get together, get along together, because basically, I'm pretty sure we all have the same vision. We want to be happy, we want to be healthy, we want to be in peace, and we want to have a peaceful world and reach peace and well-being on our planet, the Earth.